This is the first lecture for antimicrobials, and basically antimicrobials includes discussions about dentifrices, which is toothpaste, mouth rinses, and we'll also talk about irrigation. So basically antimicrobials is an attempt to prevent bacterial colonization and disruption of biofilm or reduce biofilm through chemicals to a level below the patient's threshold. So the term antimicrobial, chemotherapeutics, chemotherapy, it's all basically similar terminology meaning similar things. So basically antimicrobial therapy means the use of specific agents for the control or destruction of microorganisms, whether they're used systemically, for example taking doxycycline, which is an antibiotic to decrease the level of periodontal pathogens, or locally delivered antimicrobials. So locally delivered could be in a mouth rinse, could be in a toothpaste. It can be even a drug that's put into the sulcus, like Atrodox. Okay. So chemotherapy is basically the prevention or treatment of a disease by chemical agents. So many times you're more familiar with chemotherapy being the term of choice for cancer therapy, but it's really a broad term. So chemotherapeutic agents are the administration of antibiotics, antimicrobials. So like I said, they can be delivered in toothpaste or rinses. And rinses are classified in two different ways. They're either called first generation or second generation. So first generation is basically when the substantivity is low. Second generation is when the mouth rinse has a high substantivity. And substantivity is basically pertaining to the therapeutic dose of a drug to continue for a prolonged period of time. So there could be a very powerful antimicrobial, but it may not able to last long, and then therefore not have a good result. Okay, so some of the problems with the oral cavity is if you rinse something, then you spit it out. So if it's not able to linger on the tooth surfaces, it may not have good result. Okay. And then the irrigations, whether it be home irrigation or in office. So success of locally delivered antimicrobials depends on the delivery of the antimicrobial agent to the site, how successfully it can be delivered, maintaining bacteriostatic or bactericidal concentration, so basically the ability to reduce the amount of bacteria or kill the bacteria, and maintaining the agent at the disease site for a sufficient duration of time. Okay. So mouth rinses can also be classified as cosmetic or therapeutic. So basically when they're called cosmetic, they basically don't have any significant benefit, or if so, it's very temporary. So basically it tastes good, it's a nice rinse and may make your breath better, but that's about it. Okay? Therapeutic or preventative benefits would include reduction of biofilm, reducing gingivitis, preventing dental caries, remineralizing early non-cavitated dental caries, so remineralizing, reduction of dental sensitivity, or reduction of supragingival calculus formation. Okay, so basically everything can be classified cosmetic or therapeutic. So first let's talk about different types of toothpaste. So here are in general, most of them, this is kind of their range of ingredients. They all have a detergent, 1 to 2%, an abrasive, 2 to 20, and you don't need to memorize these percents, by the way, just, have a rough idea. Binders, humectants, flavoring, water is the largest portion. The therapeutic agent is only 1 to 2% usually, and a preservative. Okay, so the detergent, the purpose is to lower the surface tension and penetrate and loosen surface deposits. So it emulsify debris for easy removal with the toothbrush, and it can contribute to the foaming action. So some of the detergents are usually sodium lauryl sulfate, and actually that's been found to be a high allergen. So if you have a patient that's having an allergic response to their toothpaste, it could be that detergent. Abrasive is basically produce a smooth surface, provides a smooth surface that can prevent or delay the reaccumulation of stains and deposits. So there's kind of a balance. You don't want to have too much abrasion, but a little bit can be helpful. The binder is used to stabilize the toothpaste and prevent separation of the ingredients. The humectant will retain moisture and prevent hardening of the product. Okay, and it can be xylitol or glycerol, and they've actually found that xylitol can actually reduce caries as well. So it turns out it has a secondary property. Preservative is basically to prevent bacterial growth, and flavoring just to make it more acceptable, more pleasing for the patient. So in general, I mean, there's a million type of toothpaste, and there's always something new coming out. But in general, gels are generally less abrasive, and pastes with whitening tartar controls are generally the most abrasive in general. So like I said, there's always new toothpaste coming out, but it's probably easier, instead of going through each brand, to kind of talk about the main active ingredients that you may find in different toothpaste. So if a new one comes out, all you have to do is look at the main ingredient, and it's going to help you figure out what that toothpaste is really all about. So one of the a main therapeutic agent in toothpaste is called triclosan, and right now I think it's only in Colgate sells that, and it's the name of that toothpaste is Total. Okay, but generally, after a certain period of time, everybody kind of sells everything. So basically, triclosan is a broad spectrum agent. It's effective against gram-positive and gram-negative microorganisms. It acts on the microbial cytoplasmic membrane. It can cause leakage of the cell contents and cause lysis of the bacteria. It's usually combined with PVM and MA to increase substantivity and efficacy. Okay, so you usually always see it in combination. So it's known as an antimicrobial and for anti-gingivitis. In the United States, it's only sold in toothpaste, but in other countries, they sell it in a mouth rinse as well. It tends to be the most effective type of toothpaste if you're having gingival or periodontal conditions. It can reduce gingivitis by 20% and reduces supragingival biofilm accumulation of 25%. It's also in vitro studies, which means in laboratory studies, it's been found to decrease the amount of inflammatory mediators, okay, which we'll get into perio later in the year, but basically highly correlated with periodontal destruction. But again, those studies were only in vitro, so we got to be careful when we take those claims. So then the other main ingredients that you're going to find in toothpaste are fluoride. Most of them have fluoride in it, whether it be a stannous fluoride or sodium monofluorophosphate or sodium fluoride. So that's usually the main ingredient in most toothpaste. And then so it's going to be prevention of dental caries, anti-cavity formulas, that kind of a thing. Then there's sensitivity toothpaste, and a common ingredient is usually a 5% potassium nitrate. So if you see the main ingredient, potassium nitrate, you know it's for dental sensitivity. Now there's some other ingredients that they'll put in, and they're called tartar control. And tartar control is just layman's terms for calculus, and it's not really professional terminology, but it's basically to reduce the amount of supragingival calculus formation. Okay, so there are different pyrophosphate salts. So zinc salts, zinc chloride, zinc citrate. And basically the only problem with them is they tend to cause sensitivity. So if you have a patient who is complaining of dental sensitivity, but maybe before you recommend a sensitivity toothpaste, you generally want to ask if they're using the tartar control toothpaste. And usually if you just get off of that, it usually helps quite a bit. Then the other category of treating hypersensitivity are the amorphous calcium phosphate products, the ACPs, and these are basically formed by combining soluble salts of calcium and phosphorus and then form this ACP. They release calcium and phosphate ions for remineralization and desensitizing the tooth. And these substances will increase fluoride uptake. So there are many different products that contain this, professional products and at home. And it was one of the newer generations of products for hypersensitivity since the potassium nitrate. There's some talk that the ACPs aren't, that there are even better products out. Recaldent contains casein phosphopeptides and ACP, and that also decreases demineralization and promotes remineralization, as well as reducing sensitivity. The problem is you should avoid, it should be avoided by people who are allergic to milk, and also people with, I've also heard GI problems with IBS. Should avoid it. So then there's Novamin, which is similar calcium sodium phosphocylate component, which is very helpful for sensitivity, but it did not receive FDA approval for remineralization, although it does seem to do that. And that's a great product for sensitivity. Then there's the SensiStat, which also reduces sensitivity. So a lot of whole new products that have just come out in the past few years to help with remineralizing tooth surfaces, which also help with sensitivity. And here's another new product which combines fluoride and the calcium and that Novamin technology, which also does the same thing. So basically, when you're trying to select a dentifrice for your patient, it should be based on their caries risk, the amount of caries they have, whether they have dental sensitivity, if they have gingival inflammation, any perio problems, what the calculus formation is. And unfortunately, one of the most important things is personal preference, because if the person hates the way the toothpaste tastes, they're probably not going to use it. So it'll be your place to help educate the patient and help them pick out the main ingredients that they should be focusing on. But hopefully they like the flavoring of it as well.